We have Dr. Konstantin Chienku with us on the phone. Doctor, how are you doing today?
I am wonderful, thank you.
It's such a pleasure always to have you so we can update all our listeners who are listening to us in Ghana, in Nigeria, in Freetown, and all of those places in South Africa, in Kenya. So, Doctor, I'm going to start with the question of the week since we always have a question that we debate in RM show. My question that I'm going to start with, first of all, let me ask you, how you doing? How you doing today?
I am wonderful, thank God I'm in good health.
Yeah, you've been busy, I bet.
Very, very busy with the coronavirus. We have a lot of patients here in the U.S., and then we do telemedicine and online advice to patients all over the world, especially in African countries. They have a lot of questions for me every day online, and we chat and see how we can help.
And talking about the coronavirus here in the U.S., Doctor, what's the status right now? How many cases do we have? How many deaths we have so far?
The coronavirus hit a milestone today. The U.S., they have 1 million cases, and of the 1 million cases, they have had 68,000 deaths. So today they have a milestone because they have more deaths from coronavirus in the U.S. than they had in all the years they spent in Vietnam. So it's a very deadly disease. They have been working very hard. The crisis is being stabilized. The curve has flattened. And I think we have learned a lot from the virus. The total number of virus in the world is about 3.1 million. And the number of deaths is about 216,000. So the U.S. is about 1/3 of all the cases and all the deaths for this virus right now as we stand.
Wow. And so many people who are listening to us in all these other countries that I'm telling you, in Accra, in Ghana, they're listening to us right now. And those who listen to us on social media, listen to us here in the U.S., are wondering what makes the U.S. get to that point. You just said the number that's escalating here in the U.S., which is way more than what happened in China, in Italy, in France, in all over the world. I mean, what makes this number in the U.S. higher?
Well, the U.S. is a country that is almost a subcontinent. It's almost a continent. So its population is a very, very big, I think almost 300 million. But the U.S. also has dense cities. There are cities that are very dense with millions of people, like New York. I think it's about 6 or 7 million living in a very small space. And sometimes just in one building has about 50 flats with about thousands of people living in a very confined space. This makes it very difficult to have social distancing. That is one. On the second hand, the administration didn't take this virus very serious. Actually, it called it the Chinese virus, as if this virus was limited to China. And when they were informed that the virus was here, it was something very easy to go and handle. So at the beginning, they tried to dismiss it as a non-issue. They were late to get into the game. I think they're doing a better job now, but they were very late to get into the game. They weren't ready for the number of people. They don't have enough testing up to date. They didn't have enough respiratory and ventilating machines at the beginning. I think they're doing a better job today, but they came in very unprepared.
Very unprepared. What about, Doctor? As far as laboratories that have successfully verified and currently using the COVID-19 diagnostic test. I mean, do we have enough tests?
The diagnosis testing is getting better, but we're not where we have to be. There are two main kinds of tests in general when there's a virus. The first group of tests is what they call a PCR, which is a virus isolation. They take your sample and try to isolate the virus by modifying its genome. That test in general takes 5 to 7 days. It is the most accurate test, but it's not the best test in a pandemic because there is delay between when the patient is sick and when you make a diagnosis. The second group of tests is the serology test. IgG, IgM. It tests your blood response, your immune response to the test. Those tests in general take between a few minutes and an hour. Those are the best tests to do in this case. The US is still doing hundreds of tests a day.
Mm-hmm.
The estimate is that they want to be somewhere around 2 million of tests a day in about 2 weeks, and then to about 20 million a test a day in about a month. So we are still way behind. And the ideal is that everybody in the US should be tested. Because in the case of this virus, 80%, approximately 80% of those who get infected might not present any symptoms. All the statistics you are hearing are hospital statistics. What does that mean? It means it only involves 20% of the population, because in 100% of population, only 20% will get sick and go to the hospital. Of that 20%, 15% will need a little bit of oxygen, and about 10 to 5% will need intubation, and about 1 to 2% will die.
Mm-hmm.
So all the statistics we're having by us, it only reflects 20%. So you should multiply every number you get by a factor of 10 to 15 to get the real community rate.
And explain to us a little bit, Doctor, about the statistic and the map and the curve. When we read on some magazines, so we hear some professional health professionals say that the curve is going down. What is that? What does that mean? Because we're reaching a million cases and we have so many deaths, but they said the curve is now going down. What does that really mean?
When you have a disease, you want to know what the incidence and the prevalence of the disease is. The incidence is the number of new cases. The prevalence is the number of cases that already exist. So at the beginning of the disease, you're going to see the curve starting to climbing up because there are new cases. Every case is new. But after some time, you have less new cases than old cases. So the curve, instead of going up, starts to flatten out. It means we are starting to control the number of new cases. Though the old cases are still present, the new cases are less. So the curve starts to flatten. And after the curve flattens, it starts going down. Like in New York, around April 15, the curve was shooting up like a missile. By the time it was April 25th, April 25th, the curve has flattened and has started to going down. Today, the curve is where it was on April 2nd. So it's almost a C right now. So it means that though there are still new cases, though many more people are dying, the number of new cases are way lower than what it was at the peak of the disease. That is why people are saying the curve has flattened.
That's what it means.
The reason why this curve flattened is because of the distance.
Yeah, that's what I was going to ask. What makes it flatten? Yeah.
And people want to release those measures right now. And we say, no, if you do it, then we'll have a second wave. So this is not the time to stop what you've been doing and having good results. This is the time to continue on the path of what you have been doing. But there, like I always told you from the start, there's a fight between healthcare, physicians, and politicians and economists on the other hand. America has been on lockdown for more than 40 days. And there are many companies that are not going to come back. And there are many jobs that are not coming back. So you've seen the government going out to distribute money to help some people survive this downturn. And a lot of economists and politicians are looking at this downturn as a liability. What does that mean? It means if these downturns last for too long, the businesses, some businesses are not going to survive, and some politicians might not be re-elected. What is driving decisions right now is politics and elections coming up in November. Politicians want everything open, and they know they will lose some lives, but they think it's worth the risk, otherwise they're going to lose election. So they are pushing for opening of businesses and public places, which doctors are resisting at this time because they don't have the data to pointing to safety. We don't know we're safe enough to open yet.
Doctor, my next question is, when we go to, let's talk about Africa, and Ghana was one of the countries that, if not the one that was making a difference as far as doing all it could, putting lots of funding on protecting its citizen and on try to sensibilize and educate the Ghanaian how to protect themselves and to prevent this disease. But we've seen the number in Ghana increasing. We've seen it close to 1,700 cases now. So it's like, after all the effort people are doing, those numbers still going up.
Yes, the numbers are going up. Like I said, when something is new, then the number can only go up. And I would say Ghana has been a model country in Africa for some time, especially when there was this political crisis in Ivory Coast. Ghana made all the adjustments to make it an attractive country. And Ghana has been leading in a lot of areas in Africa. And they are leading right now in this effort to contain the virus. Another country that has done very well is Senegal. And Senegal has even gone forward to making tests. They are creating local testing, test strips for this virus that will cost less than $1. So they are doing very, very well in certain African countries. We encourage them. But like I said, the rate of increase or the speed of the spread of the virus in Africa has been very, very moderate. If you compare, this virus mainly came to Africa around mid-March, around March 15. That is when those travelers from Europe flew into Africa.
Right.
And we were expecting higher numbers by April 15 after the incubation period and after the disease had gone from an imported disease to a local spread. We were expecting bigger numbers. The models we were looking at were 10 times what you're reporting right now. We should say that this doesn't mean that they should stop those confinements and social distances and all what they're doing and wearing masks in public areas. They're doing a good job. They have to continue working hard. The numbers in Africa are very encouraging. We can never say good because people are dying. And the numbers are very encouraging. We don't know if it's just because of the measures the government took or the effect of sunlight and high temperature could be a deterrent to the spread of this virus. We don't know 100%. But we are looking at this and keeping an eye on how this affects the virus.
Bienvenue à bord.
Les passagers de RM Show sont priés de monter à bord.
Tolanda Kayango, RM Show Tikanayo.
Hey, la Guinée-Carlo.
Salut les amis, ici Roger Moutou de VOA Afrique, chaque soir à 20h temps universel. Pourquoi? Venez voir avec moi.
Roger Moutou la icône.
Au programme de la bonne musique. Des sujets débats socioculturels. L'interaction avec nos auditeurs en Afrique et partout dans le monde. RM Show, c'est notre communauté. RM Show, c'est chaque soir à 20h temps universel sur VOA Afrique. Peace Africa!
Another question about Africa, Doctor. We all watched, the past week, our President Rajoelina of Madagascar, have said they have found and launched a herbal coronavirus cure. And we even, saw him at the school where he was urging school children to sip it, the tonic throughout the day. But now the World Health Organization says that there's no proof of a cure for COVID-19 after Madagascar president launched that herbal coronavirus. What's your take on that?
Well, it's a very good thing, and I've had very good outcomes from using of the drug that was launched in Madagascar. And I think there was another drug launched in Benin that did very well too. So we have at least 2 African countries that are working hard to bring solutions to this coronavirus, which is a very good thing. However, in the field of medicine, before we can say a drug has done well, it has to go through some validation studies. It means it has to be tested on patients who are sick and patients that are not sick, and then outcomes measured. The problem with these new medications is that we don't have enough data to tell if these patients are cured because of the medication, or they are among those 80% of patients who will get well by themselves anyway. We don't know what quantity of medication should be used per patient. We don't know if it varies with age, with height, with weight. We don't also know the side effects of this medication. We might have a good medication that can cure you, but it might give you something else. So before the World Health Organization can say they have a medication that works, they have to go through a couple of steps, which are validation studies. First, on non-humans, and then second, on humans. So it's too early. But we think these medications are promising, and they're giving good results. And the absence of a vaccine or any validated medication at this time, we think it's a good thing to try it.
Because and I'm not I'm not a professional, but I'm just thinking out of the box, doctor. When they said chloroquine was one of the things they were looking at, and then I was reading about this plant, this cure that we're talking about in Madagascar, which is the Artemisia plant, I guess, which is the source of an ingredient used in malaria treatments. I was like, whoa, hold on. There's similarity between the chloroquine and this, right?
Correct. Like I said, even chloroquine has not been validated as a treatment for coronavirus. But it has been observed that patients did well using anti-malaria medication, be it chloroquine, be it hydroxychloroquine, be it mefloquine or attecan. All those medications, it seems like patients did well on it. But still, these studies have not been validated. And as I was telling you most recently, we have found out recently that the most important cause of morbidity and mortality, what causes death in most patients with coronavirus, wasn't the respiratory aspect of the disease. It was the clotting in blood vessels, what they call thrombosis, blood clot inside blood vessels. And when those blood clots inside blood vessels, especially in blood vessels around the lungs, it prevents exchange of oxygen. In other patients, the clot is ejected to the brain, and some patients, the first presentation is a stroke. So we have patients coming to the hospital, especially African Americans or Black, whose first symptom is a stroke or malaise because of the blood clot. So blood clot has emerged as an essential component of this disease. It remains a respiratory disease, but the biggest cause of death is clotting.
And you just give me another something that I was going to ask you. I completely forgot about it because we haven't talked in a long time. It's the rates, the number, the percentage of African American dying also raised questions throughout the continent, where African listeners were asking me, what's going on over there, doctor?
Well, the problem with African Americans or Blacks dying from this disease is very complex. And we can put it in 3 different categories. The first category is poverty and access to healthcare. Usually, your level of income dictates how much access you have to healthcare. And in general, accessibility to healthcare to the poor is very, very bad. This implies that most people who are poor usually come to the hospital very late and sometimes with major complications. The second part is discipline. And if I have learned anything living in the West for over 25 years, is that we are not very disciplined. We are not very structured. We are not people who like discipline. And then the last thing is discrimination. We have seen discrimination even on TV. There was one patient in Italy. The young gentleman was told that we're going to save our limited equipment to help other people from other races. We're not going to help you. And the same thing happened in France and it's still happening in the US. We have seen discrimination when the resources are limited. The black race is always sacrificed. So I think those three elements have come together. However, when we look at the numbers in Africa, we find that the virus is not spreading as fast as it was in Europe.
Exactly. So what's going on?
So it implies that it's not because we are black or African American that we are more likely to be sick from the virus.
And that raises another question.
We can start shifting and, discriminating and trying to find what the difference is. Another thing also which is very important is what they call comorbid factors, risk factors, obesity, asthma, sickle cell. Those are diseases very predominant in African Americans in the US. And it's a big factor in the morbidity and the mortality. That means making the patient sick and the patient dying from the disease.
Thank you, Doctor. Ending with my questions of the week. We are asking our listeners the question of the week or the day is, does Africa believe in African researchers? Why is there... another question is, why is there not more medical research in Africa? Does Africa really want to achieve its scientific revolution, Doctor?
Yes, I think we want to achieve highest level of research, and we have the manpower, and we have the brain, and we have the ability.
So what's the problem?
The problem with Africa today is that we are at the subsistence level. We lack basic necessities in life. What do we lack? We lack adequate water supply. We lack adequate energy. We lack schools. We lack hospitals. We lack basic roads. So the African is still trying to survive. So research is still a luxury in a population or a people who lack basic necessities. Research are very costly, and sometimes you spend a lot of time and money and the results are not very good. So we should do research, but we have to first be able to make sure we have our basic necessity. What does that mean? That every child who wants to go to school can go to school, that when we are sick we can go to hospitals and have basic elementary medication, and that we can have a safe country without war. So those are the basic things we need, and then we can indulge into research.
Very important. So, Doctor, those who are listening to us right now, all the Anglophone countries, what advice do you have to give them at this point where we are with the coronavirus?
There is something called the Great Equalizer. The Great Equalizer is education. Africa has to invest in education, number one. Number two, Africa has to transform the way it educates its kids. We should stop teaching kids how to read and photocopy and replicate. We should teach kids how to solve problems. Instead of asking a kid who is the head of state of every country in the world, you can ask a kid to find a way to provide potable water to the whole village. We should challenge them with real life problems instead of making them recite songs, poems, and history of every country in the world. It doesn't help us very much.
That is very, very deep, Dr. Chienku. I want to thank you so much for the time that you've given us tonight, and stay safe, especially you out there in front with so many other patients. Stay really safe. Thank you so much, Dr. Chienku. We appreciate your time.
I should be thanking you. It's a privilege to talk to my brothers and sisters. Have a wonderful evening.
Take care, doctor.